Hello, people. It's a new week. It's a new week, and I am your favorite nurse. Thank you for following me on all my social media handles at your underscore favorite nurse on Facebook, on YouTube, and on Instagram. I really do appreciate. Thank you. So, if you're yet to subscribe, please click on the subscription button and subscribe. And do not forget to press the notification button so as to get notified whenever I drop a new video. Thank you. So this week we're going to talk about urinary tract infections known as UTI. UTI. This UTI are infections that occur in the urinary system, the urinary tract, and this involves the kidney, the ureter, the bladder, and the urethra. And this is common among women. It's common among women. Why? Because you want to know that, right? You have to follow me to the end of this video. So stay tuned. I'm going to tell you why it is more common. So, and it is a very painful sensation whenever you urinate. So let's go to the causes. Causes. So the causes of UTI is mainly due to when bacteria enters through the urethra and affect the bladder. So I'm here to explain what ureter and urethra is, right? So ureter and urethra, they are different. So ureter are tubes that pass urine from the kidney to the bladder, while urethra are tubes that passes urine from the bladder to the exterior of the body. And the urethra in the female are very short, like about 4 centimeter long, and is a very bit narrow to that of the male. The male urethra is a bit broader and it's about 17.5 to 20 centimeter length. So when this bacteria lodges in the bladder, it affects the whole system. So and when it gets complicated, it can affect the kidney, which is called acute pyelonephritis. You don't want to have that, right? So the infections occur mainly in the bladder, which is called cystitis. This is caused by the bacteria Escherichia coli, while it also occur in the urethra also, which is called urethritis. So what are the symptoms of this UTI? Number one thing is the urge to always urinate, and that thing is a burning sensation whenever you're urinating, and that thing is pain during urination, especially in the pubic area, cloudy or foamy during urination, especially in the pubic area, cloudy or foamy urine, and we also have blood in urine. This is when it gets complicated. So we have the risk factors of who are at risk of getting this UTI. Mostly are women. People that are at risk of getting this UTI are women due to the shortness of the urethra, which is 4 centimeter long. So the bacteria can climb up faster into the bladder and eventually into the kidney, while that of the male is a bit longer. And that thing is the female anatomy. As we all know, the female perineal area, they are proximal to themselves, like anus, vagina, and the urethral opening. So like bacteria from the anus or the vagina can easily enter through the urethral opening, and that thing is low immune system or down immune system. This is due to diabetes or any other disease that affects the immune system, and won't make the immune system to easily fight off any infection. Another thing is catheter use. People that find it difficult to urinate by themselves, we have this tube called catheter that is inserted into their urethra to help them urinate. So the removal of this urethra, this catheter, now and then can cause the catheter to be infected. And that thing is we have people that have a deformed urinary tract system, well, urinary tract even from their birth. So that is another major cause. Also another thing is menopause. After menopause, the estrogen level in the body is reduced, so it also affects. We also have kidney, the blockage of the urinary tract. Kidney stones can block the urinary tract and to affect this movement of urine, then bacteria will begin to build up. It's just like gutter. When water doesn't have way, its own way, then it starts to build all other fungi and bacteria. So what are the prevention of this UTI? Number one thing is always drink liquid, especially water, so as to mix your urine whenever you want to urinate, so it will make you urinate more often. And that thing is drink cranberry juice. Cranberry studies have showed that cranberry juice doesn't kill the bacteria, but at least prevent it. And that thing is, whenever you are done with whatever you are doing as a female, always wash from front to back, not from back to front. Like transmitted disease like herpes and gonorrhea from the vagina can easily be moved to the front, which contains the urethral opening. So next time you wash from the urethral opening to the back. Another thing is always eat fruits that fruits that contain antioxidants. Another thing, preventive measure, is don't use all the sprays, irritating materials in the perineal area, in the vagina, in the urethral opening, or anything. Do not even wear underwears that contains all this thing. It can cause irritation in the vagina. And also people that are using birth control system like diaphragm and spermicidal agents should be very careful. They should change it, because all these diaphragms and spermicidal agents, when they are removed and planted in, they can cause bacteria to grow as efficiently in the UTI. Then the last thing, which is the solution. I said most of these things, UTI is caused by a bacteria, right, or pathogens. So, and antibacterial will be very important to help clear out the bacteria in the UTI. You have to meet your doctor, any health worker, a nurse or a pharmacist, to prescribe an antibiotic that will be okay for your system. Please, when you're having any of these pains, any of these listed symptoms, do not hesitate to call your doctor or any health worker. And do not self-medicate. Do not take drugs illegally, so as not to overwork your liver, your kidney, and to always stay in shape. Drink water, eat fruit. I love you guys. See you next week. I love you.